我能不能问一个 question?
Thank you, Dr. Tseng, for that wonderful presentation. So we do have a few questions already.
我能问一个 question 吗？
可以啊。
我的 question 是，如果你有这个 cataract need surgery， 不考虑钱，哪个方法最好？是 laser 还是 ultrasound？
OK， 我用英文再反复一次，让大家一起听。So the question, let me help translate the questions. The question is, if one needs surgery, which one is better? Is it laser or ultrasound?
For cataract.
Right, for cataract surgery. Yeah. So let me answer in English first, and then I could try also doing that in Chinese. So for cataract surgery, all cataract surgery still needs the ultrasound part. The difference is the initial cut could be done by laser or without laser. So the ultrasound is the same for all cataract surgery. The ultrasound part is just to remove the pieces and do cleanup. But the laser part is for correcting vision and also cutting the pieces up. OK， 所以白内障手术的时候都需要超音波把这个切片以后的那个小小的白内障的那个小 piece 把它拿掉，所以有 laser 还是没有 laser 都需要超音波但是 laser 是切片的时候，然后还有那个矫正那个像散光的时候才需要。OK。
那我想说，这个，因为我有这个问题，我也看了一个 Duke 的这个医生，他在 Winston-Salem 这边这个一个 center， 他是说，我是怕就是说有的 doctor 哈 ，laser 是比较 new technology。那有的人虽然是很好的 technology， 但掌握不好，用了会不会适得其反？就是
对。So the question is, she says that she has cataracts problem. She's seen a Duke doctor in Winston-Salem, but she's concerned that even though laser technology is new and very good, she's worried that maybe there's going to be potential complications. So I mean, every technology has could have complications, right? So anytime you do surgery, there's always a small risk. But actually, laser has a lower rate of complications to me in my hands than if you do it manually. And plus, it's a lot more precise. So I actually think laser is a great way to go. And just depends on the individual doctor, and also depends on your eye condition too. So everybody's eyes are different.
Okay, thank you.
Yeah.
Three questions.
I think we also have some questions. Yeah, sorry, I think we also have some questions in the chat as well. Let's see. But okay, so we'll take it one at a time. So first question is, how often is a regular exam? So I'm going to answer mainly in English, but if anyone wants me to translate into Mandarin or Taiwanese, let me know. So how often is the regular exam? Well, so it depends on your eye condition. So after the first initial exam, after some testing, based on your level of cataracts or glaucoma or any other eye conditions, the eye doctor will then let you know. So for example, if you come in and turns out you don't really have glaucoma and just very early cataracts, then once a year should be enough, at least once a year, annual. But if you do have glaucoma symptoms or findings, or if it's really advanced, then sometimes we might have to see you, every few weeks to every few months. And so it really depends on how your eyes are doing. And then let's say if your cataract is already at the point where you need surgery, then obviously then you want to start doing consultation and measurements and planning for surgery. So it really depends on findings in the exam. So I would, urge you to at least get an initial exam and then talk to the eye doctor about that. Okay. And second question, is it possible for early stage glaucoma to heal and recover to normal? So I'm not sure what you mean by heal. So when you have vision loss in glaucoma, when it's early versus advanced, and you actually lose vision, what's lost is lost. You cannot recover it. So if healing means recovering vision that's lost, that's not possible. And so the question is, what's early and advanced? And that really depends on just how much vision you've lost. So when we classify glaucoma as early, usually it's like 10% of your sight vision or less or something like that. Whereas versus advanced, you might have lost 80% or 90%. But whatever is lost, that's gone. Okay, so that's why it's important to screen early and then treat early so that we don't lose more and more over time. So that's glaucoma. That's different than cataracts. Cataracts with surgery, we could actually, recover vision, but glaucoma, no technology, no surgery, no treatment in 2022 could recover lost vision. And that's why it's very scary. Okay, next question. Can anything be done for prevention of both eye diseases? Okay, so let's start with cataract. Cataract is really not something that's preventable. And often I don't even think of it as a disease. I think of it more as an age-related change, okay? So everybody will eventually get cataracts. It's about as sure as my white hair, right? If you are lucky to have lived long enough, eventually you'll have cataracts. The difference is how soon and how severe, and then whether you have the level of whether you need surgery or not. So unfortunately with cataracts, there's really no way to prevent it. We could slow it down or have it show up later in life by keeping a healthy lifestyle. So if your body's healthy, your eyes will be healthy. So for example, if you're a smoker, try and stop smoking. That's going to be important for all aspects of your health. Obviously, alcohol, drugs, and things like that. You want to stop that and eat healthy. So just vegetables. Balanced diets with vegetables and fruits. You don't have to go crazy with vitamins. Okay, a lot of people take supplements and vitamins. None of those have really been shown scientifically to prevent cataracts or glaucoma. Okay, there are vitamins for other eye diseases, but not for cataracts and glaucoma. So for cataracts, there's no way to prevent any worsening. Now, glaucoma is a different issue. So there's no way to prevent glaucoma from showing up. But once we make the diagnosis and once we start treating, we could slow down the disease change, okay, with treatment. So the treatments I talked about by lowering the eye pressure, that will slow down glaucoma. Again, there's no vitamins, there's nothing else we could do. And a lot of it is related to age, a lot of it is related to genetics and other things that unfortunately we can't really control. So hopefully that answers that question.
Dr. Tseng, I think we may have missed one question about are nerve scans typically covered by insurance?
Oh, yeah. So I'm slowly getting there. Yeah. So those nerve scans are typically covered by insurance when it comes to, if it's testing for glaucoma and things like that, and then repeat testing as well. Yeah. Okay. So let's see. Where are we now? Sorry, we have a lot of questions, so I'm trying to go back to where we stopped here. So if anything could be done for the prevention of both, oh, we did that. For glaucoma, how can we monitor the eye pressure at home? So that's a great question. It's very hard to do your own monitoring. There's actually some devices now, and some actually are under research, where you could buy the device and measure your own eye pressure at home. I don't recommend that yet because right now, most patients have trouble doing that. And then once you have a measurement, what does that mean? And the reason why I say that is everybody's normal pressures are different. So if someone has advanced glaucoma, the pressure level that we need is different than someone who doesn't have glaucoma. And the pressure for those people could be higher. So there's no such thing as a perfect pressure. And it really depends on your level of glaucoma and vision loss. And that's typically determined, with the help of your glaucoma specialist. And so even if you can monitor pressure at home, the information may not be helpful, by itself. And like I said in my slides, pressure itself is not the only thing that we check for glaucoma, and it's not the main cause of glaucoma. No one knows what really causes it, but that's the only thing that's a risk factor that we could treat. Okay, so that's that question. And then the next one, for cataract laser surgery without insurance, how much does a surgery typically cost? A range would be great. Yeah, so I can't speak for other places, but since I work at Duke, I could give you what Duke charges. It's a very standard price for every eye doctor who works at Duke. And so for laser itself, the laser is $1,000 per eye that you pay out of pocket. The insurance pays for the cost of the whole surgery, which is over $10,000. But the $1,000 is just specifically for the laser. And then the other implants, depends on what implant you want, could be anywhere from $1,000 to $2,600 per eye. So when you do cataract surgery and you want to factor in the cost, make sure you think of the cost for both eyes, because you need to do the same for both eyes. Okay, so is it sufficient to see an OD annually before you get any symptoms to see an MD? Oh, absolutely. Yeah, so an optometrist is often a great place to start for an eye exam, for glasses, for contacts. Typically, depending on the optometrist, they will do a full eye exam by looking inside the eyes. And then typically they will also look at the optic nerve and the retina. And if they find anything abnormal, then they would refer the patients to an ophthalmologist for further testing and then treatment. So often a lot of my patients come to me through referrals from optometrists. And there's just not enough ophthalmologists and glaucoma specialists all over the country. So we work very closely with optometrists for that reason. So let's see. And often after they see me, and if the eyes are normal, then I tell the patients that it's okay to do checkups with their optometrist once a year, and that's fine too. And most of them could do pressure checks and all these standardized testing as well. Okay, next question: is there any eye exercises that could improve your vision? So the main answer there is really no. This is a very common question. Eye exercises only help if your eyes are not lined up straight. So if your eyes are off or like crossed, some people then use eye exercises to treat that. But beyond eye movement, there's really no eye exercises for cataracts and glaucoma. Like I said, cataracts and glaucoma is mostly age related, so there's not much we could change there. Is this video recorded? Couldn't find on YouTube for future review. That I'm not sure. Ben, I think we're recording this, right?
That's correct. It's recording it and we'll post that.
Yeah, and I'm not sure about the YouTube part, so I'll leave it to Ben and the Asian Focus organizers. And there's actually on YouTube, there's a lot of other videos that other doctors have made too about cataracts and glaucoma. So hopefully they will also be very helpful too. Let's see, for glaucoma, can laser surgery replace eye drops? When to decide to use laser surgery? Seems all the eye drops have bad side effects. Yeah, no, that's absolutely true. So any medications have side effects. And of course, cost is an issue too, because now you have to buy eye drops, every month and pretty much for the rest of your life. So typically, depending on the findings in the eyes, I actually recommend laser first now. Laser surgery is very safe. This is a newer version of lasers compared to older previous versions, and very easy to do. We can do both eyes in the clinic. And when it doesn't work in everybody, just like medication. But when it does work, the effect is pretty good. Doesn't last forever. And so we can always retreat in the future. And often when it works, then we don't have to depend on eye drops, and patients, don't have to struggle with cost and doing eye drops. So yeah, so laser surgery could replace eye drops initially. Now, if the glaucoma keeps getting worse despite laser surgery, then that's when we'll also put patients back on additional drops, because each of these things will, help bring the pressure down a little bit more. What is the cause of glaucoma? So that's a very good question. So the bottom line is nobody knows what causes glaucoma. So this is an area of scientific research that we're all working hard on. At the very, sort of basic level, glaucoma is actually a neurodegenerative disease. So it's actually very similar to like Alzheimer's and Parkinson's. When you have brain and eye change, the difference between glaucoma and Alzheimer's and Parkinson's is that instead of memory that's affected or movement that's affected, in glaucoma, it's vision. it's the part of the brain that's involved in vision. So like we're basically doing a lot of brain and eye research and studying why these brain cells involved in vision die. Yeah, so that's a very tough question, the cause of glaucoma. And maybe in the next few years, we'll find out more answers for you through research. So what causes floaters? And is it a sign for those two diseases? Do you advise fixing floaters in the eyes? So floaters are different. Floaters are not really symptoms or signs for cataracts or glaucoma. So if you think back to the slides that I showed you, the cartoon of the eyeball, in the middle of the eye, there's a lot of jelly material. And when you have cellular debris or just junk in the middle, very small little debris, and the light hits the debris and you see the debris, that's what a floater is. So a floater is just, some junk moving around. We all will have a few, anywhere from 1 to 5 floaters, and they'll come and go. They'll change shapes and they may change locations and they move with your eyes. The one time when floaters are a problem is if you see a lot of them. So if you see 50 or 100 all at once, that's a bad sign. Especially if you start seeing flashes, sparkles everywhere, or like a shadow blocking your vision. When you see that many floaters, that's actually not cataracts or glaucoma. That could be a retinal detachment or a retina tear. And that's a different problem. So if you have that many floaters all at once, then find an eye doctor or call your eye doctor as soon as possible, because that's an emergency and then you need maybe emergent retina surgery. Okay, so should we see OD or MD for initial eye exam? Roughly how much it costs for persons without insurance? Yeah, so for the initial eye exam, either one will be fine. So most people will go to the optometrist first, just get a glasses check, and hopefully they'll dilate the eyes. You got to dilate the pupils and look inside, and hopefully they'll check the inside, and if things look normal, then you're okay. But if they have any abnormal findings, then usually optometrists will send you to an ophthalmologist for further checkups and evaluation. Sometimes I'll see patients for the first time too, and MD will be fine if you want to see one for initial eye exam. It's much harder to get an appointment because we're usually pretty booked up and backed up. But either optometrist or an ophthalmologist will be great for initial eye exam. Cost without insurance. Now that depends on the practice and things like that. I don't really know because most people don't go without insurance or vision plan. So you may have to call ahead and check with the optometrist or the practice to see how much it will cost. Could Dr. Tseng post his clinical office phone number for a point? Oh, sure. Yeah, we could do that at the end. I'll be happy to do that. If not, you can always contact Asian Focus. They know how to also get in touch with me, but I'll certainly do that. Where are we now? How soon should we treat cataracts? No, that's a great question. So that depends also from doctor to doctor, but I can speak for myself. So my recommendation for patients usually is, if glasses is not helping anymore, and you're starting to have problems doing what you need to do. So for example, driving or reading or watching TV, and your vision's dropped to a certain level where insurance will cover the surgery, then that's when we could start thinking about cataract surgery. But even at that point, there's no rush because cataracts don't really damage or hurt the eye. You still have a little time to think about options or wait a little bit longer. And so there's no rush for cataract surgery. But that's a decision that depends on you and the doctor, and you can make it together. And like I said, functionally, everyone's functional needs are different. So if your work involves driving a truck at night or flying an airplane, obviously I would recommend getting surgery earlier. But if you are not doing that and you're mainly just working at home on the computer and you're still seeing okay, then there's no need to rush to do cataract surgery. Okay, so what is the impact of diabetes on the eye? So that's a great question. That's another whole area and potentially a whole separate talk. Maybe in the future we could have a talk on diabetes and diabetes in the eye. But diabetes in general affects your blood sugar, and when the blood sugar is up, you can have a lot of changes in the eye. And basically the back of the eye, the retina will have bleeding areas. You can have retinal tears. You can have fluid leakage. And the back, a lot of the retina basically is not getting enough oxygen because of the high sugar level. And then over time, if the sugar is not treated or the retina is not treated, then you could actually get a different type of glaucoma. It's called neovascular glaucoma. And that's a different area. That's hard to treat because when there's not enough oxygen in the eye grows a lot of random blood vessels. And the blood vessels then clog up the drain and cause pressures to go up. So so diabetes impacts the eye as well as the rest of the body in a very significant way. But the way to avoid all that is just to treat, to make sure your blood sugar and your blood pressure is well controlled. Are you able to share the slides for those who missed the first few minutes? Oh, absolutely. So Asian Focus organizers have that, so they could certainly share that with you. For glaucoma, we could use eye drops to slow down the progress. When do we need to do surgery? Is there bad effects by using eye drops for a long time? Thanks. Yes, so surgery is usually reserved for patients who continue to get worse despite eye drop treatments or lasers. Okay, so there's a lot of different eye drops that we usually try, and there's lasers. And typically most patients will be controlled on that. But there's a small group of patients who just keep getting worse. And then that's when we could talk about surgery. And surgery, we could go into the eye and we could construct a drain. We could put a tube in there and make like a shunt to drain fluid, or make a little pocket where fluid could come out. So as you can imagine, it's very delicate surgery and very involved. And so the complications and side effects from that is a lot greater than eye drops or laser. So the second part of the question is, are there bad side effects by using drops for a long time? And yes, absolutely. Not bad as in, bad as in you'll go blind from the drops, but bad as in it's very irritating to the eye. Some patients develop severe dry eyes. The eye actually hurts and you could have trouble seeing. The eye turns very red. And sometimes even the eyelid down here and around here could develop allergies, skin allergies, and it's very itchy, very irritating. And you can imagine how that's going to affect your vision and your work and your daily function. So a lot of patients who use eye drops long term do develop these side effects. So it's not without side effects. Can floaters be connected to taking some type of medication? Typically not. Okay, and I think I covered floaters earlier already, so we'll move on. Frank, we plan to get the seminar. Okay, Facebook. How serious is it when your vision gets weak to read captions on TV or road signs from a distance? Oh, okay. Yeah, so that may actually be early signs of cataracts. If you're talking about captions on TV and road signs, that's distance vision, and early signs of cataracts basically consist of those. So that's when you definitely want to go and get your eyes checked. And sometimes just by changing your glasses, that should be enough to help you read captions and drive better. If glasses don't help anymore, then that's when the cataracts may need to come out through surgery. The other important thing is if you have these symptoms, when you go to the clinic, we also make sure you don't have other eye problems. Sometimes there's other eye problems that could, also affect your reading and driving. And so if you have other eye problems, obviously we want that treated as well. Is bleeding from the eye any indication of glaucoma or any disease? So bleeding could be at many levels. So sometimes you get bleeding on the outside, just the whites of the eye. Usually that's just from, like if you have superficial trauma, rubbing the eye or sneezing or coughing, and it's just a small blood vessel that breaks. If it's just on the outside, it's not too bad. If it happens a lot, then you should get your blood checked because that may indicate you're not able to clot. Now, if you're talking about bleeding inside the eye, then that's a different issue. Typically, that's not from glaucoma, but that could be from other eye diseases. And that could be signs of diabetes also that's affecting the eye and other things. So, if you get your eyes checked and there's blood in the eye, then obviously we'll need to do more testing to try to find out the etiology of that. How about vitreous detachments? Lots of floaters. Can you treat it? So not really. So vitreous detachment is not glaucoma. It's not cataracts. It's still an age-related change. And the jelly in the eye over time, as we get older, just becomes less flexible, and it condenses and shrinks, and it comes off the back of the eye. And that's what's called a vitreous detachment. And there's no consequence. It doesn't really damage the eye. The concern there is sometimes when the vitreous comes off, it might rip the retina or cause a detachment. And then you got to get the retina repaired and fixed. And the floaters, like I mentioned, if you have hundreds, 50, 100 floater all at once, you may have a retinal tear or detachment. But if you only have 1 or 2 or 3 or 4 floaters, that may not be as bad. And with just a few floaters, there's really no treatment for floaters. It's very annoying, and this is a very common question, but there's no effective treatment for floaters that's worth doing. And if you have a bad retinal detachment, then one might need laser or actual surgeries to go into the eye and take the jelly out. And that's obviously very involved. Okay, so are eye treatment surgeries covered by medical and vision insurance? Yeah, they typically are, but it depends on your insurance and depends on what the problem is. So usually if it's a medical problem, then the insurance could cover it even without vision plan, but don't quote me. And vision plans, I think usually are for like glasses and just annual checkups. But if you need surgery, then that's different. Now Medicare and Medicaid usually covers a lot of these surgeries and treatment as well. Okay, next question. How about different types of lenses for cataracts? I assume that question has to do with lens implants after cataract surgery. So if you saw in my talk, I was talking about there's new lenses for correcting different types of vision problems. So you could have lenses for correcting distance vision, astigmatism, presbyopia, reading, or hyperopia. So it depends on your eyes, depends on what we find, and depends on measurements, and which typically we do in the clinic when you come in for a cataract surgery consultation. And that's when we could go over what lenses are appropriate. And it also depends on if you have other eye problems. So if you have bad retina problems or diabetes or glaucoma, then certain lenses may not work or may not be worth the money, to pay for fancy lenses. Okay. How will computer monitor light impact our eyes? Very good question. So, with COVID, we're all sitting in front of Zoom like we are now. Too many meetings, right? Too many computer screen time, and iPads and iPhones. I mean, we're basically glued to our screens now. So this is a very good question, and a lot of doctors are doing research to look at this. So far, a lot of the scientific studies have shown that the light from the computer do not directly damage the eye. Okay, you could get symptoms from fatigue, your eyes tired. You could get symptoms from dryness because you're staring at the computer screen. But that's not the same as eye damage, So far, the computer lights seems okay for the eyes. One effect that is interesting that people discover is that these bright computer screens or the iPad screens, while they don't damage the eye, but they could affect your sleep cycle. Okay, so I just want to throw that out. So if you have trouble sleeping at night, and a lot of people do, you don't want to use the iPad or iPhone or your phones or your computer after dinner, because if you use it too much at night, the blue component part of the screen could shift your circadian rhythm back. So then you become almost like you're jet lagged. Okay, so only if you have trouble sleeping, but if you have no trouble sleeping, then you should be okay. All right, so do we need to get new lenses after some years for cataracts? So I'm assuming that means they're asking, do you need to get a new lens implant, after cataract surgery? And the answer is no. So once the implant goes in, it's made from plastic and basically lasts forever. It lasts longer than all of us. The only time we have to take it out would be if you have any problems, or if you have injuries, or you have trauma where you hit your eye and there's a problem with the implant. But if not, if everything's all normal, then they just stay in there forever. So it's a one-time surgery, And once the implant goes in there, you don't want to take it out. And there's no need to clean it. So that's another common question. There's no need to take it out to clean. It just stays in there. What's floater in Chinese? Fei Wen Zhen. Yeah, that's it. So floaters in Chinese is Fei Wen Zhen. What might be the issue if one eye tends to show more white than the other? I'm not sure what that means. I think maybe that refers to the whites of the eye. Maybe one eye looks whiter than the other one, like the other one might be a little redder or darker. So I'm assuming that's what the question's about. And it depends. So if one eye is lighter than the other, sometimes just pigmentation. One eye may have more pigments and pigmentation on the whites of the eye. Maybe there's a little bleed. So if someone is bleeding a little bit, then that eye might look a little red. Or if the eye is dry and fatigued from overuse, then one eye might be redder than the other, and so the color might look different. How often should you have an eye exam? Good. I think I answered this earlier, but I think just to reiterate, the main thing is you got to get the initial exam. And then based on the findings of the exam, then your eye doctor will recommend follow-up. So if everything's normal, then once a year is what we recommend. But if you have any problems, then we might have to see you more frequently to address the problem. Okay? What is the age max limit for a person to undergo removal of cataract? Example, senior 95-year-olds fit and safe to undergo cataract removal? Yes, absolutely. I've operated on patients who's 95 years old. It's very common. You know, we are all living longer, and everyone's very healthy, even when they're 90 years old. So as long as your health is good, then it should be pretty safe. The key thing is, you know, you got to be able to also lie flat for about half an hour. We don't want you moving, you know, things like that. So age is not the issue. So as long as you're healthy, that will be fine. What we're looking at computer screens for a long time cause nearsightedness? Not really, no. So like I said, you know, computer screens have been studied extensively, so it doesn't cause nearsightedness. And I guess also maybe the question talks about, you know, reading up close. You know, as we get older, we have trouble reading up close. That's not caused by a computer. It's caused by getting older, unfortunately. Okay. And what are the first signs of glaucoma? So like I mentioned in the slide earlier, most glaucoma, there's no signs. There's no findings. The eyes look normal. Okay. And most patients don't realize they're losing vision. So that's most glaucoma. The only time when you could have symptoms is, like I mentioned in the slide, the angle closure attacks. And those are very rare. But most people, more than 95% of people, there's no signs, no findings. The eyes actually look normal. And that's why it's actually scary, because people don't know they have glaucoma, or people don't know that they're losing vision, and they're not getting checked and treated until it's too late. How long can glaucoma laser surgery last? I assume that means the effect of the laser, right? Not how long the actual surgery takes. The surgery itself is only about a minute or two, so it's pretty quick and easy. The effect could last anywhere from 1 year to 5 years. It's not forever, it's not permanent, but usually 1 to 5 years, and the pressure might start to go up a little bit. And if that happens, we could go back and retreat. And usually we could retreat, you know, 3 to 4 times and still have a pretty good effect. When you feel your eyes cannot stare at monitors because of tearing, what part of your eyes could go wrong? No, nothing's wrong. So when you start to tear and get tired from staring at monitors, that just means you're overusing your eyes. So that's time to stop, take a break, close your eyes, maybe 5-10 minutes. And it's also, you may have dry eyes. And so then you want to use eye drops. It's called artificial tears. You could get these over the counter at, you know, any drugstores or Walmart, even Costco and Sam's Club. You could get artificial tears, get the ones that have no preservatives. And you can put those in when your eyes are, you know, tired or hurting, or if your vision's blurry from staring at computer screens. So a general guideline that I tell my patients is this: with every hour of screen use, it's good to stop for about 5 to 10 minutes. Okay? Every hour, it's good to stop for 5 to 10 minutes. Don't go for 5 hours straight without stopping, and your eyes are going to be dry and tired. And when I say stop, the best rest is to just close your eyes or look outside the window, something far away. Okay? Don't go from your computer screen to your phone, because a lot of patients tell me, hey, I do take a break. I check my email, I look at my line, I look at the phone, read the news on my phone, and I took a break for 5, 10 minutes. Remember, that's a mental break, but a mental break is not the same as an eye break, okay? So when you're going from a computer screen to your phone, your eyes are actually working even harder, right? So we don't want that. So yeah, again, the best thing is every hour, close your eyes or look out the window for about 5 to 10 minutes, and that will help you last longer. And then you can use artificial tears. Are fancy IOLs a little bit harder to get right now? No, that's not true. So usually when you're ready for surgery, we place the order, and then we can usually get them from manufacturers pretty rapidly. So there's, as far as I know, there's no shortage and no problems getting the fancy, we don't call it fancy, we just call it premium or multifocal or toric IOLs. Okay, I think I got to the end of the list of questions. Any other questions I could help answer?
Thank you so much, Dr. Tseng.
Oh, absolutely. My pleasure.
我可以问一个问题吗？
哦，是可以啊，请问。
最早的这个 lens 放在这个白内障里面的是最简单的，就是 single focus 的 lens。那个好像是成功的比率最高，对不对？那是不是比较最 reliable 就是 single focus 的 lens？
Oh, okay. So the question from Alan is this. So one of the earlier lenses that was developed is the monofocal lens, which is just for single vision, meaning you can kind of see far away or up close. So his question is, are these monofocal lenses more reliable than the newer lenses, like the premium or the multifocal lenses? My answer to that is no, they're both pretty good now. So there's 3 main types. There's the monofocal, which is just single vision. There's one just for astigmatism correction. That's called toric. And then there's the what's called multifocal. You can correct distance, up close, and even astigmatism. And all those lenses went through many generations of improvement. And they're all pretty good now. And so, it really just depends on your personal preference.
就是我想请教一下，像那种 toric 的 lens， 好像它有一个角度要放进去眼睛的时候要放对，对不对？那如果那个 angle 如果不太对的话，我知道好像有的人还要再做 secondary 的那个 surgery 去 correct 那个 angle， 是不是有这种情形呢？
No. So the question is this. So for toric intraocular lenses that's used to correct astigmatism, isn't it true that the lens has to be placed at a certain angle? And then in some patients, is it also true whether the angle might have moved and then they need a second surgery to fix that? So that's the question from Alan. The answer is yes, both are true. So the toric, anytime you correct for astigmatism for really high levels, the toric lens has to be put at a specific angle, pretty close at least. But sometimes with surgery, it looks good in the operating room. If you go home, things may move and things may change during the healing process. And unfortunately, doctors have no control over your body at home. And so if that happens, then you could go back to the surgery room and just move it and kind of move it back into position and fix that. Now, so that's what the toric lens. Now, if we correct astigmatism with the laser, that's involved in cataract surgery, then you don't have to do that with the lens. So then the laser itself will reshape the cornea to do that.
Oh, okay. 好，谢谢曾医师。
Do you need me to explain that in Chinese too, or is that okay?
That's okay. That's okay.
Okay.
I can understand. Yes, sure, no problem.
Okay, perfect.
Dr. Tseng, I have another question.
Sure.
It's about the visual field test. Is that reliable? Because when I did it before, it's kind of like a very quick. The light just pop up, and sometimes I just miss it. Those lights. It's very trouble me because I cannot focus. To look at one point all the time for I don't know how many minutes. Is there any other alternative?
Detroit.
No, that's a great question. Visual field tests are hard to do for everybody. And so the reliability depends on the patient, and it sometimes changes from visit to visit. One visit, patient does great. Sometimes next visit, if they have a bad day or if they're tired, then it may not be as reliable.
Right.
So you're absolutely right. But there's also a learning curve. So the more you do, the better you get at it too. But it's better than nothing. So the computer monitors how reliable you are. It actually keeps track of your eye movements, and it could tell us how reliable the test results are. And based on that the variables, we could still make a diagnosis and get an idea of how much vision you lost or haven't lost. So it's better than not doing it.
But my question is, any other alternative to run, to diagnose the, glaucoma?
So that's not the only test we use. So if you remember back to my slides, we use pressure, we use the nerve scans. The nerve scan is a picture inside the eye of the nerve, and then we actually measure how much nerve tissue you have. The problem with glaucoma is there's no just one test. So we actually use all of these tests together to determine if the glaucoma is getting worse or not. But other than visual field testing with a computer, there's no other ones for actually testing your sight vision. We actually have some research projects trying to use other devices, including measuring brain responses and things like that. But that's all still research right now, so not ready for the clinic yet.
So right now, I have my left eye has high pressure. Then I use the eye drop. Now it seems like it's controlled. But can I ask the doctor to do the optical nerve scan instead of
that they probably even already have done that. I don't know if they mentioned it or not to you, but they should. It's usually the combination of the scan and the visual. The scans are newer, so this is a technology that's only been developed in the last 10 years or so. So some offices may not have the machine or may not be comfortable using it. We've had a lot of experience at Duke because we were involved in some of the early research. So to us, it's basically a standard now. So everybody with glaucoma needs that. So if your doctor's office doesn't have that, you're welcome to come and we could do it for you.
I went to the Duke clinic in Cary. I don't know where they have it.
So they should have it. Yeah, they should have it. Yeah, so we have lots of satellites. So Cary, they should have it. They probably even have done it.
Oh, okay. Because they only focus on say you need to do the visual field test.
Oh, I see.
I was wondering.
Okay.
Okay. Thank you.
Sure.
不好意思，曾医师，我可不可以再问一个问题嘞？
Oh, sure. Yeah. 请问。
平常我们碰到医生讲白内障，都说两个眼睛一起开比较好，就是等另外一个眼睛也需要开的时候一起开。那我曾经碰到一个朋友他可能他的 case 是比较特别，他一个眼睛就只开一个眼睛，然后开完那个眼睛以后嘞，那个眼睛就视力就矫正好了嘛。那另外一个眼睛还有近视嘞，他就戴一个隐形眼镜，所以变成他只开一个眼睛的白内障， 然后另外一个眼睛戴隐形眼镜。那他这样子也过了20年了。那我想请教一下曾医师，您的意见，这种开法是好还是比较不好？他的 case 可能比较特别啦，他一个一定要开白内障 ，yeah。
对对，他的很特别。So the question is this, Alan was asking, when you do cataract surgery, most people typically do both eyes, right? You operate in one eye first, then do the second eye. He had a friend who only had cataract surgery in only one eye. The other eye did not get surgery, but because he was nearsighted, then he wore a contact lens in the other eye for over 20 years. So Alan's question is this typical or is this recommended? And so my answer is, your friend's case, like we said, is pretty atypical. Most people who get cataracts from sort of age-related change will get it in both eyes. Now, a lot of patients will get more cataracts in one eye than the other if they have other situations. So for example, if they had trauma, right? If they got hit in the eye, if they took medication or they have like steroid medication or they have glaucoma or other diseases in that one eye, but not the other, then the cataract in that one eye could change much faster than the other one. And so if that eye needs surgery, then typically we recommend just going ahead and doing that to see better. But if the other eye is normal, then there's no point in doing surgery, because then if you have a complication, you can actually lose more vision. So typically, we don't rush in to do the second eye. We could do contacts and glasses. If they can't tolerate contacts or glasses, then we may still end up doing surgery in the second eye, even though it's not that bad. So it depends on the situation. So in your friend's case, he was able to tolerate contact lenses. And so if that were me, I would say, yep, just go ahead and do contacts and wait a little bit later, longer before cataract surgery.
Okay, thank you.
Yep, very unique situation, yeah.
Yep.
Little Henry, I have a question. Is the Duke Eye Center can do the yearly check?
I'm sorry, I missed it.
Duke Eye Center 是不是可以做年度检查？
可以啊，可以。So the question is, could the Duke Eye Center do annual checkups? Yeah. So like I help people do annual checkups too. So all the doctors, pretty much could do annual checkups. The hard part is getting an appointment, because as a specialist, most of my patients have glaucoma or cataract problems, right? So it's harder to get a regular checkup appointment with someone like me. But we have general eye doctors. We have optometrists too, who could do eye checkups. And then if everything's normal, then hopefully you don't have to see me. But if there's a problem, then we're happy to help out. Okay, so one more question. What test can I request to detect if you have glaucoma? Thank you very much. Oh, yeah. So like in the slides, the typical tests that we do are, like the visual field tests, right? And then the nerve scan or the pictures, or an eye pressure. And then the last important thing is the full eye exam. You want the doctor to look inside the eye and look at the optic nerves. All these machines do not replace the doctors yet. So the most important is still you still need a specialist and a doctor to look inside the eyes. Okay, good. Yeah, any other questions? Oh, I think earlier someone was asking about clinic information. So sorry, the easiest way is just go to the Duke Eye Center website. So all the information's on there. So, Duke Eye Center just have a general website. I see patients at the main campus and also at the South Durham Clinic. So the South Durham Clinic is right next to South Point Mall. So it's very right next to I-40, a number for appointments. And if you have any specific problems or you need to see me more urgently, feel free to contact the Asian Focus organizers, and they could certainly, and I could try to get you overbooked or squeeze into a clinic. But we're pretty booked out. I think our next appointment might be anything from 6 months to 8 months out, just for a general appointment. But yeah, feel free to, if you have any urgent issues, then we could try to squeeze you in. Okay.
曾医师可不可以再问一个问题嘞？
可以啊 ，Yeah。
Yeah， 我老婆常常讲我是问题老公嘛，因为我问题。我要就是说，我想请教，就是有 dry eye 的情况哈，这次会不会让 glaucoma 或者是 cataract 比较不利？就是说 dry eye 会不会造成就是 glaucoma 或者是 cataract 会更进展的更快嘞？干眼。
Okay. Yeah. So his question is, if you have dry eyes, could dry eyes cause glaucoma or cataracts to deteriorate or progress faster? The answer is no. Dry eyes is just on the surface. So it doesn't affect the pressure, it doesn't affect the nerve or the cataracts. It can affect your vision. So some people have dry eyes and cataracts, and then both conditions will affect your vision. But if you have dry eyes, then you don't want cataract surgery if it's not that bad, right? So you just want to treat the dry eyes. So it doesn't make cataracts or glaucoma worse, but you still want to get that treated. So now, so we could still improve your vision. Does that help, Alan?
Yes, it's very helpful. Yeah, 你讲的一点都没错。好像现在冬天比较冷哦，而且也比较 dry， 所以有时候看东西就觉得比较就是看不清，比较看不清楚。尤其像最近下雪啊，我们 North Carolina 下雪，现在如果出去走路的时候，那种冷干的空气，好像让眼睛的 dry eye 是不是更严重
？Yep. So his follow-up question is, with the cold weather, especially the snow this weekend, it seems like the cold weather, the cold temperature, and the cold air dries out the eyes more. And the answer is yes, and you're right, very accurately described. So the cold air holds less moisture, right? So if you think about, back in chemistry and physics, warm air holds more moisture, and cold air has less moisture in the air. So when you go outside, your eyes exposed to this dry air, and then when the wind's blowing, it will dry your eyes out too. And so when the temperature gets colder, it's going to affect the dry eyes. And then in the house, when you turn on the heater, the central air heating systems that we have are dry, right? It's forced air. So cold air and the heating will both dry out your eyes. So in the winter, dry eyes tends to be worse. And then you spend 5 hours on the computer, then you're just going to be, very dry. And so here's some things I typically recommend to patients. So in the house, if you can, use a humidifier, spray some water into the air with a humidifier, and that helps. And again, just take breaks. And then when you go out and come back, use some artificial tears to kind of rehydrate the eyes. So these are just simple things you could do.
Okay, thank you very much.
我有一个问题我每天早上起来眼睛都很痛，都要用热水来敷眼睛，好像那个眼屎都出不来，一睁开就不能睁开眼睛。这个东西是去看一般的 eye center 的检查就可以，还是要有特殊的医生要约？
Oh, okay. So the question there is, in the mornings when I wake up, I have mucus and this white mucus coming out of the eye, and sometimes the eye hurts. So should I see a specialist for this? So the answer is you really don't actually. So a lot of the mucus is just from dryness. So your eyes might be dry the night before, or even when you're sleeping. And so the eyes sometimes make a lot of tears. So you could tear a lot, or if you have mucus. So in the morning, if you have a little mucus, that's okay. You can wipe it away, use some artificial tears. And sometimes if you use a warm compress, soak a towel in warm water and just put it over your eyes, that helps a little bit too. So that should be pretty simple. You don't really need to see a specialist for that. Most eye doctors could help you with that. And the last thing is sometimes you have a lot of oil on the eyelid. And if that's the case, you could just use some baby shampoo to kind of wash that away. And you can do that in the morning and do that at night to keep the oil from building up. So, yeah.
Thank you.
Yeah, sure.
陈医师想请教你一个问题，就是好像肚子饿的时候，在那个外面如果光线很强， 然后进到里面了，有时候会发现眼睛里面好像有白云了，就是眼睛闭起来也发现有一个白云，如果张开的话会觉得蛮刺眼，就是说觉得那个光线好像很刺眼这样子。做这个是不是需要去看医生？
Oh, okay. So the question is this: when there's bright lights coming through the windows, even when the eyes are closed, the light is very bright and it hurts her eyes. So should she get checked? And so the answer is yes. If the sunlight's always very bright, but if it's even brighter and it hurts the eye than usual, it's possible you might have cataracts. Cataracts will, cause glare and scatter the light, but also you might have other eye conditions. So it's probably good to just get checked.
可是发生在只有偶尔发生，而且好像只有肚子饿的时候才会有这个感觉，而且不一定什么时候，可能一年发生1、2次、2、3次这样子。
Oh, okay. So the follow-up question is, it doesn't happen often, just once or twice a year, and it seems to happen only when she's hungry. So I don't know about the hungry part though. I don't think there's a connection between hunger and the eye. Maybe it's just the timing. If it only happens once or twice a year, it might just be where you're sitting. Maybe the light is just happens to hit your eye at the angle that it's too bright. Sunlight is pretty bright, so never look at it. And unfortunately, even without cataracts, the sunlight could be super bright.
好，谢谢。
Oh, how? Okay.
Any other questions for Dr. Tseng? Maybe one more.
Okay. Yeah, Dr. Tseng. 有时候突然之间眼睛会一下子剧痛，一只眼睛突然剧痛，大概持续大概2秒钟，然后之后就没了。请问过医生说那可能就是干眼症，点眼药水就没了。那大概1年会发生个3次，差不多这样子。请问是什么问题？是干眼吗？
So the question is, occasionally he'll feel some pain in the eye, sometimes just one eye, and it'll last a few seconds. It may only happen a few times a year, and he's actually seen an eye doctor who said it's probably just dry eyes. So he wants to know if this is consistent with dry eyes. And yes, right, 就是干眼症, yeah. So your symptoms are very typical for dry eyes, especially if you're using the computer a lot or a screen. And sometimes you'll get sharp pain, or it feels like there's sand in the eye, right? And then it feels scratchy. And sometimes when you blink, it makes it better. Or if you put artificial tears in. And it doesn't happen all the time, but it could come and go. It depends on dryness. Yeah. Do you need me to use Chinese, or are you okay?
I'm okay. Thank you very much.
Okay.
But one more
Sure.
question. One more
Sure.
question. So
Sure.
sorry. 每年做眼睛检查的时候，医生吹那个压力风 （pressure air） 到眼睛里面要测我的眼压，但是风一来的时候，我自然会把眼睛闭起来，所以他得到的 feedback 的压力都是有一点insufficient， 所以他就只能估计说我眼压还可以。所以我的问题是，第一个，这个眼睛自然闭起来是不是 DNA 遗传造成？没办法，因为 I can't help it。第二个就是那怎么办呢？有没有其他的办法测眼压？谢谢。
Okay, yeah. So the question is this: whenever he goes for his annual checkups and they check his eye pressure, they use an air puff to check the eye pressure. Fortunately, he then blinks and then shuts his eye very quickly. So he's wondering, whether this is accurate or not, and whether there's other ways to check the eye pressure. Yeah, so that's one way. So there's actually many ways to check eye pressure. So the air puff is one of the common ways that most eye doctors will use to check the pressure. And, closing the eye, that's normal. That's a normal reflex. So that's actually good. But usually the machine is so fast that it could get the measurement before you have a chance to close your eyes. So you don't have to worry. But just the technique of using an air puff usually is not as accurate. So in the glaucoma clinic, we don't use that at all. We actually numb up your eye and use a little tip that comes close to your eye and touch your eye. And that measurement is a little more accurate. And there's many other ways where we use a handheld device that also touches your eyes, but then we get a pretty good measurement. So, but the air puff is a great way to screen, to do a quick check to make sure it's not really high. But if you do have glaucoma and you need treatment and we need to get more exact, then usually we use other techniques. Okay, does that help?
医师，我可以再问一个问题吗？
Sure, yeah.
我想请问一下，就是有的时候，这个是看完就是在 computer 看了很久以后，有的时候我走到另外一个房间，譬如说灯光一打开之后，我会有一个眼睛突然就是眼前是一片漆黑，什么也看不到。有的时候是一片漆黑，有的时候是一片都是很强的亮光，也是什么都看不到。然后只是短短几秒之后，然后它马上就恢复了。一年大概这种也不频繁，就偶尔一两次而已。请问这种我需不需要 worry， 还是说就不要管它？
Oh, okay. So the question is, occasionally when she walks from one room to another room, or like from a computer to somewhere else, her vision will suddenly black out or look really, she'll see a bright light for a few seconds until the eye then readjusts and then back to normal. And so she was wondering if this is something worrisome. And this happens only a few times a year, so very rarely. So yeah, so the answer is that's fairly normal because your eyes have to adjust. It depends on what you're looking at on the screen. If it's bright or dark, sometimes you get a little after image too. But then if you go from room to room and you have different lighting, then the eye and the brain has to readjust. And usually if it's a second or two, that's normal. And so I'm not too worried about that. But as long as you get your eyes checked and your eyes look okay, then that's fairly common.
好的，谢谢。
好，没问题。不需要中文翻译吧？
不需要。
不需要 ，OK， 好。
曾医师还有没有时间呢？可不可以再问一个问题？
可以啊。
就是有时候就是会发生那个 eye migraine 就是好像就是眼前发现一个好像 halo 一样的东西，大概会 last for about 15 minutes， 然后15 minutes 以后就好了，就是前面好像有个亮圈这样子的，跟那种有个光环这样子，然后有时候会慢慢变大，这个情况好像叫做 eye migraine， 然后这个跟 glaucoma 有没有关系啊？
Oh, okay. So the question is this. So he sometimes gets eye migraines where you can see like a bright circle or bright sort of halo for about 15 minutes and then goes away. And so he's wondering whether this is related to glaucoma or not. So the answer is no. So eye migraine is not glaucoma. So what you're seeing is actually not in the eye, but it's in the brain. Okay, so vision is eye plus brain. And migraines is due to just abnormal blood flow in the brain. And so temporarily you see these light shows for about 15, 20 minutes, and then it goes away. And some people, they get eye migraines and then they get a headache, a migraine headache afterwards. And so the lights sometimes warn them of the headache's coming. And all these symptoms are actually a brain, it's caused by the brain, not the eye. And so it's not related to glaucoma at all. So that's different. Okay.
那这种情形是不是血管的问题呢，还是神经的问题吗？
It's hard to say. So the question is, what is causing this? Is it a problem with the blood flow, blood vessels, or is it more of a neurological thing? So the answer is it's more of a blood flow problem. So it's not a stroke. So don't worry. Okay. So not a stroke, but sometimes it's more like a cramp of the brain. You know, like your legs. Sometimes you get a cramp in the leg, right? You could get cramps like that in the brain temporarily and then recover from that. Okay, so, but no one knows exactly what causes, but just know that there's just abnormal blood flow through the brain. And then as long as it recovers, so usually it should not last more than 30 minutes. But if it's longer than 30 minutes, then you know, it's good to get your eyes checked and maybe even a neurologist to check the brain.
那如果是 brain 的话，可能是跟 brain 里面的血管有点问题，对不对？那如果是 brain 的血管的问题，是不是表示跟 cholesterol 或者是跟血管可能有 plaque 或者
对
这方面的问题？
So his question is that if it's related to a problem with blood vessels, so is it because of cholesterol issues, or maybe is there a plaque or blocking the blood vessel? So the answer is no. So if you have a plaque, that's almost like a stroke. Okay, so I want to emphasize migraines is not a stroke. Okay, there's really no evidence is really related to cholesterol, but you know, because it happens actually in a lot of young people. And again, no one knows what the exact cause is. Sometimes people get these things from food, from stress, from being sleepy, and sometimes chocolate could do that too. So we don't know what triggers the cramp in the brain. So when I say it's a blood vessel problem, I don't mean it's a blockage. It's more of just like a spasm in the blood vessels. Okay.
哦 ，OK，Thank you。而我常常发现这种情形的时候，大部分是我从暗的地方走进一个亮的房间，然后那个亮的房间大部分是用那个 fluorescence 那种日光灯，那种会闪的那种日光灯造成的。
Yeah, so his comment was that he notices these ocular migraines seems to be triggered by when he walks in the room with fluorescent lights, especially the ones that flash on. And so you're right. So everybody has a different trigger. So in your case, it might be a different light source. Like I said, some people, it's actually certain types of food. Some people is stress. Some is from not sleeping, and some we don't know. So everyone has a different trigger.
OK， 好，曾医师，谢谢，多谢。
哦，不要紧，所以免担心啦。真正像讲，你知影救筋无？从脚救筋，真正像头脑小可救筋安尼尔，暂时的，所以唔是中风，所以免紧张。
哦，安尼我就较放心啊啦。
Hey, so I'll just reassure him that this is just a cramp in the brain.
谢谢。
Hey. Okay, good. Any other questions?
我有一个快速的问题，就是说我配了眼镜后，好像不到2年，好像比如说看远就看不清楚了，是不是又得重新配呀
？So the question is, he just got new glasses, but it seems like after a year or two, then it doesn't seem to work as well in the distance. So do you have to get a new pair? Is that your question? Does that sound about right?
Yeah. 这个老花主要是老花镜。
对 Yeah, and especially up close. Yeah, so unfortunately, when you're 40 years and above, trouble reading up close, and that's normal for everybody. So that's called presby. Every year, it's going to get worse and worse. So sometimes every 2-3 years, you have to get a new prescription. Sometimes even 1 year, you have to get a new prescription. And even distance vision could be affected. And sometimes, if you saw the picture of cataract, the lens changes shape as the cataracts grow. And so the focus will change in the distance. So it's very common, to have to change the glasses every few years as we get older. So that's normal.
OK， 多谢。
我还有一个问题啊，我最近眼睛视力变得比以前还好，我都不用戴眼镜。我看到 YouTube 说这可能也是不正确的，可能也是有那个白内障之前的征兆，我是不是需要去给人家检查？
你的意思说你本来是近视，然后现在不需要戴眼镜了？
也不是近视，就是近视会慢慢变好，那个是正常的。我现在就是因为我都在台湾配眼镜， 这几年没回去，后来眼镜搞丢了，我发现我也不用戴眼镜就可以开车干嘛的。
Okay. So
那还有就是我看电视和电脑荧幕，有时候也发现我那个矫正视力好像也不需要戴，要拿掉才反而还看得更清楚。
So his question is also very common. So he's saying, he used to need glasses, but he feels like his vision is getting better and better over the last few years, so that he actually sees better now without glasses. So that's actually very common. And the bad news is that's also age-related change. So as your lens, the lens inside the eye changes shape, and as you get older, some people actually, could see better. And then unfortunately, after a few years, then they'll keep getting worse and worse and worse. So this is just temporary right now. And then in a few years, you might have to, go back to glasses. But this is something you can enjoy temporarily.
So I don't have to worry about it right now.
No, you don't have to worry. This is a normal age-related change. Yeah.
Thank you.
Yeah. Okay, good. So I think it's now 4:40. So I'm glad to see so many people still on, and I'm still happy to answer questions. But if you have to leave, then that's okay.
Any other questions for Dr. Tseng? Been so gracious for this time, but if there's any other questions, I'd like to get the platform for people to ask them.
Hello， 曾医生，你可以听见我讲话吗？
听得到。
听得看，我是从文茂打来的。
OK， Hi， 你好。
我最近就是要那个要进行这个白内障的那个手术。11月2号我应该是做这个手术，但是呢，因为我有 Parkinson， 他早上给我早上5点多钟就起来了以后，一直拖到下午差不多3点钟才进手术室。我清清楚楚记得我进了手术室了。他说我们都进了手术室，我说好白呀，我记得这么清楚。结果后来过了一下子，我醒了以后出来说，我儿子说没有开，我怎么了？他说你动得太厉害，所以医生就非常 concern。那现在他把我 reschedule 到 Vermont State University， 也是在 Burlington 附近。那现在他又给我 reschedule， 那我的意思说，是不是一定要go through这个 whole body 的这个麻醉？
OK， 我懂你的意思。我先翻译用英文。So her question is this. So Shirley actually is calling in from Vermont, and her question is this. She has a history of Parkinson's disease, and recently in November she was scheduled for cataract surgery. So she actually went to the operating room, but the surgery had to be aborted and canceled because she was moving too much. And now she has to be rescheduled to go back with general anesthesia. So her question is this pretty common? And yes, actually. So one of the major things for cataract surgery is, the surgery is very delicate, so we cannot move. And unfortunately with Parkinson's, it's a movement disorder. And in some patients, if the Parkinson's control, we could still do the surgery. But if there's too much head or body or arm movement, then it's not safe to do the surgery. And most of the time, when we do surgery, we just use numbing drops and sedation. So the patient is typically still awake. Might be groggy, but still awake. But we don't use general anesthesia. So in her case, if she's really moving too much, then the safest way to do this is to do general anesthesia, where we just have her go to sleep completely. And so this is common too in patients who cannot hold still. And it's no one's fault, but we just want to figure out what's the best way to do the surgery safely.
所以现在这个新的医生就答应给我，他说我一定给你排在这就是手术室那一天的前面几个。
对。 你如果全身麻醉这样是比较安全因为你如果头还动来动去的时候，这手术的风险就太高了
太大。
对对，当然全身麻醉也有全身麻醉的风险，所以你的麻醉师会和你讨论 ，right？
还有问题是2个礼拜以后要开另外一个眼睛，左眼先开右眼，后开左眼。那我这2个礼拜，我不知道他并没有跟我讲是2个礼拜。上一次第一次 schedule 是因为 station 的关系，所以他给我 schedule 2个礼拜以后开另外一个眼睛。我这2个眼睛可以这么近2次的这个 general 麻醉，全身麻醉对我没有什么太大的影响，一定还是有。
应该是没问题但是不一定会2个礼拜，要看这个结果，开刀的结果，那看你的眼睛的恢复怎样子速度，有时候这时间可以再改变，所以不用担心。So her follow-up question was she's scheduled for surgery in one eye, but then the other eye within 2 weeks. And if she needs general anesthesia for both eyes, is that safe? Is that okay? So basically, my answer to her is that it's fine, and she may not even necessarily get the other eye within 2 weeks. Sometimes the schedule and timing might be pushed back depending on outcome of the first eye, the surgery of the first eye, and then how she responds. So, but either way will be fine, and the doctor will help to make that determination.
OK， 谢谢你，谢谢
，Good luck.
好，谢谢。最后一个。
So Ben, how long do you want the webinar to go?
Yeah, it's as long as people have questions, but I also don't want to be very cognizant of your time. Thank you so much for being so willing to share it with us.
Oh, I'm happy to be here. I'm happy to help.
Hi, Henry. Can you hear me?
Yes. Hey, Jose, how are you? Yeah.
All right. How you doing? I have a question. I use glasses for distance, like driving, but they're not very strong. When I'm around the house, I usually don't use them at all. I feel fine. I don't get headaches or anything like that. Is that a good thing to do, or would it get worse if I don't use them? Or
oh no. Yeah. So if you don't use glasses, your eyes will not get worse. Okay. The glass is just a tool to help you see better. But if you don't use it, and as long as you could see, then that's fine. Most of us, if you don't have glasses, it's fuzzy and we can't see, right? So it's completely up to you. And when you're driving, you got to look farther away. So that's why you probably need the glasses when you're outside, because the distance vision is farther down. But in the house, everything's up close and pretty near. And so most people do well at home without glasses. So
okay, thank you.
No harm done.
Okay, thank you.
Any other questions for Dr. Tseng? Well, Dr. Tseng, thank you so much for being willing to share your expertise and as well as your time with us today in the community to talk about, which was originally be cataracts and glaucoma, but because of your general knowledge and expertise, able to help with all these other questions that came up. So thank you very much for that. Is there anything else that you'd like to add?
My pleasure. No, and I think this is great. I love what you guys do. I've been involved in Asian Focus. Before COVID, remember we used to have health fairs and we have the Dragon Boat race, and we typically help out with the eye screening. And so we do these question and answer sessions there. But I'm glad that you guys are able to switch over to online Zoom format so we can continue to help folks in the community. So thank you for your hard work. Yeah.
Thank you for being here. So everyone, we will be posting this on our different platforms. Of course, limitations of platforms may keep us from being able to post it, but we'll try to at least get links up to direct you there. And based on feedback as well, we'd like to encourage you to reach out to us if there's other medical seminars that you would like to host. We hope to be doing these regularly. And so, yeah, please just let us know if there's something that you'd like for us to cover. And with that, we'll end that today. I hope everyone has a great rest of the day. Stay warm and hopefully stay dry as well, too.
Okay, great.
Have a great one, everybody. Thank you.
好，谢谢。
Thank you.
Just you.
Thank you very much.